Hi, Dr. Pelto here. Today I want to talk about something called midfoot arthritis. I'm going to do a deep dive and talk about this condition that can happen to you. If you have it, you probably know, or you may just think you have a lump in the middle of the foot on the top. You may notice that you have some pain as you're walking. And I want to kind of explain this condition to you so you can understand it a little bit better, as well as some of the treatment options. We're going to focus mostly on the non-surgical options. There are some surgical options to fuse the joints, but I want to focus more on some of the non-surgical. And specifically, there is a new type of device that can be used to make it feel much more comfortable when you have this midfoot arthritis. So let's go through and talk a little bit about what arthritis is. So arthritis is where there's a connection in the bones in the foot, where the bones are supposed to be have cartilage. And when that cartilage is destroyed, it causes spurring and it causes arthritis. And this is a very common area in the middle of the foot. There are certain foot types that are more prone to developing this midfoot arthritis, such as a flat foot. Very common for a flat foot because of all the extra movement that happens as someone is moving with midfoot arthritis. Okay. It really depends also how long you've had these symptoms going on, because the longer you have arthritis in the middle of the foot, the more pain that you're going to have. Some people have tremendous arthritis but have no pain. Other people have very mild arthritis, but they have a lot of pain. And there are different types of treatments for this condition, but midfoot is different than heel or the back of the ankle arthritis, and it's different than arthritis in the front of the foot. And first of all, I just want to talk a little bit about the exams that you might be getting if you're having this. An X-ray is usually sufficient. Doing an X-ray will show how bad the arthritis is. You could do a CT or an MRI, but usually an X-ray is sufficient for that. And then in terms of the treatments, there are different types of treatments that you might consider, and I'm going to go over those. First of all, in order to reduce the pain, you can do a cortisone injection into the joint. If you're going to do a cortisone, it may last up to 2 months, and I tend to recommend doing it with ultrasound guidance. What ultrasound guidance is using an ultrasound to find the exact joint that's painful, that's inflamed, and you can take the needle and inject it right in there. I want to be clear, though. An injection, it tends to be painful because you're putting a needle into a very small space, and then you're injecting liquid that's going to kind of almost open up that space a little bit. And that tends to be painful for our patients. If you want to avoid doing the cortisone injection, you can also do oral steroids. That'll help temporarily. Anti-inflammatories, Motrin, ibuprofen, things like that help temporarily. Icing will help temporarily. Topical creams, pain-relieving creams, I don't find all that successful. There is a little bit of improvement I found for certain patients with something called shockwave therapy. I'm not going to go too much into detail about shockwave. It's not a first line for arthritis by any means, but there is some research showing that it can change, not create cartilage, but it can make it feel a little bit better. So shockwave can help it. Let's go into some of the other types of treatments that we might want to consider. Up until a few years ago, you didn't have that many options to reduce the stress and strain. I always go in terms of a continuum. I always recommend first a nice stable shoe. So a stable shoe that doesn't have a lot of flexibility. There are many shoes today that have material on the side that wobbles your foot too much. A lot of wobbling or a lot of movement in your foot is going to make those joints more painful in the middle of your foot. So more of a stable shoe that's laced tightly. You may have to alternate your lacing a little bit, especially if you have a prominence on the top of the foot. You may have to skip one of the holes as you're lacing. You can do kind of a skipping to avoid that pain in that area. So I would start with the shoe. Occasionally, if you have a lot of swelling, a compression sleeve can be helpful. I don't find it resolves everything, but doing a tight compression sock or a compression sleeve can help you. So that's the first step. The second step then would be to put an arch support. An arch support is significantly different than an orthotic. An arch support is one you can buy over the counter, usually $20 to $30, may last 6 months, may make it feel better, may not make it feel better. What's the whole idea of a arch support? Gives it a little cushion, gives it a little support in the arch, and makes it feel better by moving less. From arch support, then the next step up there would be doing a custom orthotic. So a custom orthotic contours high to the arch, however high your arch is, and it allows the foot to move less. And so up until recently, that's all. Those are all the treatments that I have, and I'm going to talk about a newer treatment that I'm excited about. But before that, I want to talk a little bit about a fusion. There are some surgical options. One of the options is to surgically fuse those painful joints. Very commonly, it's the second and third metcuneiform joints. Those are the joints in the middle of the foot that tend to be painful. And you can do surgery where you make an incision, you scrape out the cartilage, and you put in bone filler in that region, or bone to help it to fuse, and then you put screws or plates or whatever your preference is. So up till now, that's all the option that you had if you have really bad pain. But there are a couple of other options, bracing options. And the first one is called the meso brace, M-E-Z-Z-O. And this is a brace. It's kind of like a very tight ankle brace that goes right around the middle of the foot, and you tie it down. It's made out of leather. The technical term, we call it a gauntlet brace, which is a tight brace made out of leather, goes around there, and that fits in your shoe. And that was helpful for patients. That was the one I've been using for a number of years, and certain patients love it. Other patients say it's too bulky in their shoe, they don't want to use it, so on and so forth with that meso brace. And so there's a new brace that's out there. It's called a carbon fiber brace, a carbon fiber called AFO, which is an ankle foot orthotic. So what a carbon fiber AFO is, it's made of carbon fiber. It has a foot plate that goes in your shoe, and it goes up the side of your leg into the front of your ankle. And what this does is it stores the energy, okay, that's going through the brace when you walk, okay? And I'm just going to look here. So it stores it. And as you walk, you come in contact, and as you move forward, it builds up that pressure and that energy in the brace itself. And then as you're kind of moving forward, it kind of flips up the back of the foot. So it puts a lot less stress through the middle aspect of the foot as you walk. Now, this type of a carbon fiber brace can be used for plantar fasciitis, can be used for Achilles tendonitis, drop foot, and then it can also be used for midfoot arthritis. And the reason that we think that it works is because when you walk, and you're lifting your foot up, your Achilles tendon pulls on the back of the heel, and as that tendon in the back pulls up, it bends the foot in the middle, and it makes that arthritis worse. And what this brace does, it stores up the energy, and as your heel lifts, it uses the energy that's stored up in your walking, and it makes it lift without having to bend at the middle of the foot. That's the way this ankle foot orthotic works. There are certain types that are just the carbon fiber, and there's others that have orthotics built into them or placed on top of them. And so that would be an AFO that has something built on top of it. So if you are dealing with mid-foot arthritis or arthritis in the middle of the foot, you might want to consider some of those types of treatment options. I'm going to put a couple of links to other videos. I have a shoe buying guide type of a video, and I have another video on different types of ankle foot orthotics if you want to learn a little bit more about it. But the name of the orthotic is either Aero Spring, that's a technical term of a type of a brace, or there is something called a carbon fiber AFO. I'll put a link underneath this video. There's one you can buy on Amazon, but just be aware, I wouldn't go just buying it. What I would do is I would check with your insurance, because many times insurance covers a brace like this through the insurance because it's something that's medically necessary. So this is a good option for you if you're considering surgery and wanted to try something else to avoid it. This is good for you if maybe you tried a meso brace, the other type of a brace, and you didn't like it, or if you've done cortisone injections and it's helped. So once again, hope you guys find this beneficial. Please subscribe and like this channel, and put any questions you might have underneath here, and I will try to answer them. Okay, thank you.